Hey everyone, polycystic ovarian syndrome is one of the most common reproductive disorders which can affect so many different health parameters, but particularly with fertility, we see that up to 10%, it's estimated even up to 15% of the population in certain countries can actually be affected by PCOS. And it's a condition that we've learned so much about over the last few years, definitely over the last 2 decades, where we went from PCOS being one singular, just very simplistic criteria defining this condition to now we're understanding there's actually different subtypes of polycystic ovarian syndrome. Um, and I think the most interesting, path that we've seen in the research is looking at how insulin sensitivity, glucose metabolism, blood sugar control seem to be a very central component in how something like PCOS continues to persist in the body and continues to impact infertility by lowering progesterone levels, reducing ovulation rates, potentially increasing the risk of miscarriage, increasing androgen hormone, hair loss, acne. So, this role on glucose metabolism and glucose control and insulin sensitivity seems to have a very central role on how we can actually modify the impact PCOS has on reproductive and fertility outcomes. So, very interesting research over the last decade looking at how different gut microbiomes can actually make a condition like PCOS a lot worse, and how certain strains of bacteria and strains in the microbiome can actually really improve outcomes for something like polycystic ovarian syndrome. So I think the most interesting research that looked at this found a specific strain of bacteria called B. vagatus. And this strain of bacteria basically was found to increase the breakdown of something called bile acids or conjugated bile acids in the digestive tract. And now, bile acids help to carry a lot of different components from the liver, so different drugs, hormones that are metabolized come out with the bile, and the bacteria will actually break up that conjugated bile acid into deconjugated bile acids. And what they've seen is that deconjugated bile acid will actually reduce the production of a very important chemical or immune system signal called interleukin 22, IL 22. And with this decrease in interleukin 22, what we see is that there's an increase in inflammation, there's an increase in glucose levels spiking, we see there's decreased sensitivity to insulin, and it perpetuates a lot of these polycystic ovarian syndrome symptoms. And they even did a trial where they took this specific strain of bacteria from a group of patients that had PCOS, took that strain of bacteria and in that fecal sample gave it to mice. And what they found was that these normal mice that didn't have PCOS, as soon as they had that strain introduced into their gut microbiome, they also developed the symptoms of polycystic ovarian syndrome. So there was obesity, anovulation, testosterone levels going high. So we see that this bacteria had a big role in perpetuating the symptoms of polycystic ovarian syndrome. And that was just one strain. And we've seen over the last few years with new research how other strains of bacteria can actually make it harder for us to have better glucose control, and how certain plant compounds, for example, berberine is a personal favorite we use with patients, seem to decrease the concentration or population of these microbiomes, which are harmful for PCOS or seem to perpetuate weight gain and poor blood sugar control, and seem to increase. The berberine also increases the concentrations or populations of the healthy bacteria, which help to support better elimination, better absorption, and we see reduced conversion or production of something called short chain fatty acids. And short chain fatty acids in the digestive tract are an issue because they increase the production of something called peptide YY. So peptide YY or PYY is something that reduces the gut motility in general. So you might be backed up, there might be more constipation, And this increases the chance and interaction time to have something like more deconjugation, so breaking those bile acids apart. So basically what we've seen in practice is treating the gut microbiome, treating the digestion, and improving this insulin sensitivity and glucose control in patients diagnosed with PCOS seems to make a very big difference. And a compound like berberine, for example, has been compared in head-to-head trials with a medication called metformin. And metformin is a medication which is used often for polycystic ovarian syndrome to help improve blood sugar control, insulin sensitivity, and it seems to improve regular ovulation and can help patients get pregnant. And berberine seems to be just as efficacious as metformin in some of these head-to-head trials, and they have a very similar mechanism of action. But they both seem to work in the digestive tract, and they seem to have an impact on the gut microbiome there. And it's important to mention that changing the gut microbiome also can reduce the damage that we see in the gut lining. So just having a diet, for example, that's high in fats and high in sugars, we see there's greater levels of inflammation in the digestive tract. It can increase what we call gut permeability, or if you're familiar with the condition called leaky gut. So we see increased transportation of different compounds from the intestinal tract or the lumen across the intestinal barrier to be absorbed through the blood. And that can increase damage, and it also increases the transport of toxins such as lipopolysaccharides, which are toxins from harmful bacteria. So improving our diet seems to improve the permeability of the digestive tract as well. So having a diet that's higher in protein, higher in fiber, higher in polyphenols, greater amounts of vegetables and fruits seem to repair that tight junction and can reduce things like leaky gut. And also we see that the gut is lined with cells called enterochromaffin cells. And enterochromaffin cells are where we store almost 95% of the body's storage of 5-HT. So it's the precursor to make the neurotransmitter serotonin. So we know with polycystic ovarian syndrome, one of the key symptoms or things that can develop is an increased risk of having symptoms of anxiety and depression, and serotonin has a big role with that. So there's potential hypotheses here that the researchers made on how impacting the gut, if there is greater damage, if there is more inflammation, if there are more harmful bacteria, the impact they have on these enterochromaffin cells in the intestinal tract may actually deplete the body of the precursor for serotonin. So it may potentially decrease serotonin levels. And that may be an explanation of why patients with PCOS have an increased risk of anxiety and depression, as well as we know that patients with PCOS tend to have higher levels of inflammation throughout the body. And that in itself has been shown to increase the risk of depression and anxiety. So it's very interesting because the interventions for PCOS are so holistic, to really treat polycystic ovarian syndrome or PCOS and see improvements in fertility rates. We can't just target one mechanism or one path or one aspect of the pathophysiology. We need to really address all of these, different factors and modifiable factors. And part of that is we see that what the interventions we've seen to help improve outcomes with polycystic ovarian syndrome, seem to directly impact the gut microbiome as well. So, for example, meditation, mindfulness, we've seen can potentially increase fertility success rates. And the hypothesis for that is usually we have lower cortisol levels, improved blood flow to the uterus and reproductive tract, but also these mindfulness and relaxation techniques also impact the tone of the vagus nerve, which impacts intestinal motility, the digestive functioning, the secretion of gastric acid, and how healthy that microbiome is as a result of that factor. So we're seeing that all the treatments we usually see that impact and improve PCOS outcomes may actually benefit PCOS at least to some degree, because of the effect they have on the gut microbiome. So if you're going for fertility treatments, or if you're having issues with polycystic ovarian syndrome without having regular periods or increased acne or hair loss, it's important to have this knowledge and to have the information that the gut microbiome is a huge component and should be, a very high priority in the treatment, in the holistic treatment of this condition. Because we're not just talking about, do we just modify the diet for the rest of your life, and you can't have anything with sugar and this. Definitely that's part of the plan, but it's also to heal the gut and to help reestablish a healthy gut microbiome and how that can improve long-term outcomes as well. So if this is something that's been challenging you, or someone that has been having a lot of health complications because of the PCOS, it's important to work with a licensed healthcare provider that's knowledgeable in this area. And the practitioners here at Nutricom are very well equipped to help you address this, to test for this, and to look at potential treatment options. So get in touch with us. And if you have any questions, you're always welcome to drop a message here, or send an email, and we can definitely chat about any questions you may have.